Hey guys, my name's Amanda Hatcher, and I'm going to discuss my leadership project and what was found after conducting a needs assessment of my telemetry unit. After conducting a needs assessment of my unit with a manager, it was concluded that a major need for our current department was additional education on conditions such as heart disease and COPD. This was noted after reports from nurses that many patients were unsure what the disease process entailed and how to effectively manage their disease. Some patients were even unaware that they even had conditions such as COPD and asked the nurses, what's that, or I've never been diagnosed with that. Currently, our department on admission gives a welcome to the floor admission packet, and this packet contains information about the hospital, physicians, and other information that's frequently requested, such as TV guides and vending machine locations. After discussing the project with my manager, it was concluded that this additional supplemental patient education on conditions such as heart failure and COPD should be added to those packets, and nurses could have this readily available to discuss with patients. These diseases were selected due to the high population of patients that we incur that have these conditions on our telemetry floor. The objective for this leadership project was to provide information to patients on disease education and monitoring to assist in a holistic care and enhancement of their knowledge base. Patient education is essential in healthcare delivery. Reinforcement needs to occur on just about every single patient interaction the nurse has to strive towards wellness. Patients need to have a full understanding of their diagnoses and how to effectively manage those conditions. That's essential in helping prevent disease progression and exacerbations that can cause frequent readmissions and additional costs for the patient. The purpose was to develop informational sheets for use in welcome admission packets on COPD and heart failure. The plan is to develop easily understood material that's easily accessible, patient education on heart failure and COPD, and implement that education into current admission packets. Staff also will be provided the importance of implementing this into current practice and discussing this information with their patients to ensure that there's no additional questions about the disease processes that we could provide for them. The next few slides are the information provided that would be included in the welcome admission packets. It's what you need to know, heart failure. It tells the patients what heart failure is, and that is the process when the heart becomes too weak to pump blood effectively, which can develop conditions such as high blood pressure, coronary artery disease, or other conditions that can affect the heart valves. It goes over frequent symptoms that may be reported, such as shortness of breath, swelling of the legs and feet from the fluid retention, fatigue or generalized weakness, weight gain, non-productive cough, increased urination or awakening at night, to have to go to the restroom multiple times, and also a need to sleep propped up, or an increase in pillows that they may use, or having to sleep in a sitting position. Lifestyle changes to improve disease outcomes includes dietary changes. Due to fluid retention associated with heart failure, dietary changes are essential in preventing the fluid buildup that heart failure patients experience. And this fluid buildup actually places more demands on the heart and can cause the disease to progress. It's important for the patient to understand limiting their sodium, fat, and cholesterol levels to prevent these fluid gains, and also to prevent buildup of plaque, which can occlude the arteries and further impede blood flow. They need to be able to talk with their doctor about sodium restrictions to see what specific dietary guidelines that they recommend for that patient. Usually it's a 2-gram sodium diet that they put the patients on. It would be also a good time to add foods to discuss with the patients what they should try to avoid, or foods that would be okay, or alternatives. Other sources of sodium besides food and salt can be water supplies, antacids, cough syrups, and some types of laxatives, and it's important for patients to understand that those can be other sources that they need to monitor. You can discuss different flavorings or spices such as lemon juice or herbs, to help provide a different taste for the foods instead of so it won't be so bland. Teach the importance of weighing daily at the same time on the same scale, and report any changes of 2 pounds per day or 5 pounds per week to their physician, and stress that this is important just to kind of keep a close eye on their fluid. Exercise is another lifestyle change that needs to be put in place. It's a great goal for patients to try to get at least 30 minutes of exercise each day. They need to discuss this with their physician, of course, and they can also discuss benefits of such programs as cardiac rehab, and you may want to recommend those services. It's also important to educate them on to stop exercising if they feel real short of breath or develop pain or get dizzy, because this may be too much of a demand being placed on their heart. Another thing that you want to discuss with patients is smoking cessation, which is extremely important, especially with heart failure patients. Nicotine can actually cause the arteries to constrict, which limits blood flow to the heart and puts an increased demand on the heart. And in a diseased heart, this demand is usually not compensated very well. It can cause additional stress for the patient. Medications are another thing you would want to discuss with your patient. Physicians may prescribe medicines such as diuretics to help remove fluid, medications such as control blood pressure or to relax blood vessels. They also prescribe medicines that strengthen the contractions of the heart, and it's really important to talk about side effects and any worsening of symptoms. Patients need to be aware of certain side effects of the prescriptions that they're being given, and they need to have a full understanding of what to expect and what they need to report. And I can't really stress that enough. A lot of the patients that we're coming into contact with, they're not understanding their medicines and what they're used for, or they'll stop taking it abruptly. It's just really essential to make sure your patient has a really great understanding of their medication regimen and the importance of reporting symptoms instead of just discontinuing medications. Another section that I included in the pamphlet was just symptoms that they need to report immediately to their doctor instead of just kind of letting them go on, and that would be the weight gain of more than 2 pounds in one day or more than 5 pounds in 1 week, persistent cough, any loss of appetite, increasing shortness of breath, especially with activities, and if they develop a need to increase their pillows at night or become restless or awake and find that they're just not getting as much rest as they normally do. These all are indicative of worsening heart failure or an exacerbation that may need medical treatment. This next section goes over the educational information provided for COPD. It discusses what COPD is, which is a chronic obstructive pulmonary disease. It's a disorder that affects specifically how the lungs work. It includes chronic bronchitis and emphysema. Airflow becomes limited due to inflammation that develops inside of the lungs, which can cause gases inside the body to become unbalanced and cause dead air spaces. Inflammation can cause mucus buildup, shortness of breath, and increased risks of infections. These stages are progressive and usually end with emphysema, which is an overdistension of the airways. That's where the dead space comes into play, which is just areas of non-functional tissue. The patient becomes hypoxic or has low blood oxygen levels, which can cause a worsening of heart failure if the disease continues to progress. Symptoms usually occur with COPD include shortness of breath with exertion, increased mucus production, chronic cough. The patient often develops a barrel chest appearance. They have labored breathing, and usually the shortness of breath becomes worse, especially if they smoke. Lifestyle changes to improve disease outcomes. Smoking cessation is the number one effective goal for these patients. The chemicals in the cigarettes and tobacco products, they damage the function of the respiratory system and just cause this disease to progress. Also, the exposure to the toxins damage the airways and can cause other diseases such as lung cancer that further limit airflow and respiration. The patient needs to limit the activity also to a level of symptom tolerance to prevent fatigue and respiratory failure. These patients are very sensitive, and exacerbations are usually frequent. Especially in our area, I notice that patients that have COPD, they have frequent flare-ups and readmissions, usually several times a month. To maintain compliance with medication regimens and physician follow-ups also needs to be included. They need to know how to use their oxygen if that therapy is prescribed, which they should have a firm grasp of that, but it's always essential to go over it. You may need to just conduct a HOMO2 evaluation to see if the patient meets these requirements now. Often that's the case. You may find that patients would benefit from oxygen therapy, and they need to understand how it's going to help prevent the fatigue and to increase compliance with this. Your physician may prescribe oxygen therapy to prevent shortness of breath, as I was discussing before, especially with activity. This allows sufficient oxygenation and allows more independence for your patients. Bronchodilators such as albuterol or other inhalers may be used to reduce airway constriction and improve oxygenation. And if that, those can be either administered by inhaler or nebulizer machine. And if that is how your patient is receiving those medications, you need to make sure that they have a firm understanding of how to use that equipment and know when to use it, and just make sure they understand it so they'll be compliant. Another medication used is corticosteroids, which decrease the body's inflammatory response. Their use improves the symptoms but doesn't treat or stop the disease progression, and it's important for patients to understand that it's not a miracle drug and it's not going to prevent those flare-ups, that other things need to come into play. Other treatment options to discuss with your physician that you may want to include would be pulmonary rehab programs and medication or smoking cessation assistance. That you can discuss the benefits of flu and pneumonia vaccines to help prevent further respiratory distress. And then they need to be aware to call their physician at the first signs of a cold or flu-like symptoms, so those can be treated promptly and avoid situations such as respiratory failure. You need to stress the importance of avoiding irritants such as pollen, fumes, and dust, and especially it always comes back to smoking cessation and avoiding those toxins and chemicals inside cigarettes. I also included in the knowledge packets some additional information for smoking cessation, just because it's a common problem, and this is just gives places that patients may be able to go to and find additional help and help to control those. You could also offer nicotine patches while your patients are in the hospital, or discuss with the physician treatment options. After researching trials conducted on disease-specific education programs and information, results showed a positive influence that this material had on health outcomes compared to patients who didn't receive this education. Disease-specific education, it empowers patients and it builds a sense of understanding and confidence. Patients often lose motivation after being discharged and continue to struggle with disease treatment regimens. This all could be prevented or at least decreased by providing patient education. It is important for nurses and physicians to build confidence and understanding that allows this motivation and self-empowering to continue even past discharge. Nurses need to ensure that patient needs are being met. It's important to actively listen to patients and not just hand them a stack of information without going over the material. This causes patients to become discouraged or frustrated and not look at the information provided. Nurses should also determine the patient's learning style and preferences and make adaptations to education. It wouldn't be a great idea to provide a patient with written material if they prefer demonstrations or discussions, for instance. This just wastes time and is ineffective. It is also important to adapt information so that it interests the patient. Make sure that the information addressed is meeting that specific patient's needs. The patient must understand what's in it for them and how it will affect them. They don't really care about how it's going to affect someone else. Assess for any limitations or learning barriers that the patient may experience and provide alternatives for those. It's also a great idea to include family members which are a source of motivation and strength for patients and are often their cheerleaders, so to speak. Break education up into sessions. Don't just go in the room and overwhelm patients with information. At each new session, you want to discuss the previous topic and determine retention and recover any material that needs readdressing and address any types of questions that the patient may have. Education is essential to provide the patients with an understanding of their disease process. Without it, education and communication, patients just suffer disease progression and lack the confidence in disease management. The educational materials that I've provided are considered to be an icebreaker. They're not intended to provide patients with the only source of education in their hospital stay. They merely serve as a starting point for education discussions to occur. Staff should really try to always provide patient education on every interaction, no matter how small that they may believe that education is. Just make that your goal. Each time you go in the room, you need to find some source that you're leaving that patient with that's going to empower them. Doing this allows for better outcomes for the patient and can also decrease exacerbations, which just cause lack of motivation or confidence to decrease, and it can be costly for the patients and for hospital depending on how the health coverage would occur.